Climate change is one of the greatest global threats of the 21st century. Extreme heat waves are becoming more frequent and are associated with increased complications and greater mortality and vulnerability among people with the most prevalent chronic diseases: cardiovascular, metabolic, such as type 1 and 2 diabetes, neurological, mental health, and respiratory conditions. In a field where knowledge remains limited, it is essential to promote projects that allow the identification of at-risk populations and the establishment of new preventive and public health strategies. The MútuaTerrassa Research and Innovation Foundation is in a privileged situation to become a leading reference in the study of the effects of climate change on these chronic diseases, as it possesses access to a large population database, with a territorial sample of more than 300,000 people. More than 15 years of digital health records integrating all levels of public healthcare, enabling a high level of population traceability. Agreements with other leading partners in complementary areas such as climate science, environmental science, metabolomics, epigenomics, and artificial intelligence. The Foundation, supported by the recently created Chair of Health and Climate Change of the University of Barcelona and MútuaTerrassa, is able to promote groundbreaking research with the potential to define new preventive strategies in public health. The first projects are already underway, addressing various lines of research. For example, the analysis of how the thermal comfort conditions in homes affect the health of vulnerable patients during heat waves. The analysis of the impact of climatic and environmental factors on the progression of chronic diseases through predictive models. Or the study of the mechanisms linking climate change to these diseases to identify susceptibility profiles, clinical progression, and prevention measures. And this is just the beginning of a paradigm shift in understanding the effect of climate change on health. It is time to act and support research that can change the future of our health.